All right, good afternoon. Welcome to the VHHA and Virginia PSO sponsored webinar on engaging the front line in process improvement. I would just like to review some general housekeeping items with you all before I pass this off and we get started, just in case you are new to this platform. Slides were sent out this morning to those that were registered. If you registered late, you can also access the handouts in the handouts section of the GoToWebinar platform. This webinar is being recorded so it can be shared with others who are unable to attend live. We do ask that you please dial in using the telephone option if you are able. You'll be prompted to enter your audio PIN, and this will allow us to have a discussion at the conclusion of the webinar. At this time, all participants are muted and all panelists are unmuted. If you do have a question, we ask that you hold that question until the end of the webinar, but you may ask a question in two different ways. One, you may raise your hand by using the palm with the arrow on it in the GoToWebinar platform. Hopefully you can locate that now, and I ask that you practice using it so we can be sure you can ask your questions later. It is located on the left-hand side of the Grab tab. Please do this if you are dialed in with the telephone only. If you are dialed in with either your computer's audio or using a telephone, you may also ask questions by accessing the Questions platform, which is located on the tab menu, and there you can just type in your question and I'll be able to review it. And with that, I will turn this over to Joan Williamson, Director of the Virginia PSO.
Good afternoon and welcome. The VHHA and the Virginia PSO are pleased to present to you the third in a continuing series of brown bag webinars that promote safety culture and high reliability. Today we are pleased to bring to you Tamara Parsons, Quality Director for Mountain State Health Alliance, and her presentation engaging the frontline staff in process improvement and having fun along the way. Mountain State Health Alliance has hospitals in Virginia that are members of VHHA, and the Mountain State Health Alliance is a member of the Tennessee Center for Patient Safety, PSO. So we welcome that PSO collaboration. And Tamara, it's all yours.
Okay, thank you, Joan. Thank you again for the opportunity to share at least an introduction to the Mountain States Quality Awards program. On the slide in front of you, I've outlined some objectives that I intend to cover over the next 20 to 25 minutes. So by the end of this session, or roughly speaking around 12:50, you should have enough information to be familiar with the Mountain States Health Alliance Quality Awards program, understand the four components of the program, be aware of some of the benefits of such a program, and then know where to go to get more information if you're interested. So on the next slide, I'm having trouble advancing. The next slide, I've just introduced to you the topics that we'll cover, a very brief introduction because I don't want to spend our few moments on that. The bulk of the time will be spent digging into details around the four components, and those components are project entry, judging, recognition, and sharing. And then I'll wrap up with a conclusion. By means of introduction, this is just a snapshot of who Mountain States Health Alliance is, and Joan has actually already introduced our organization, so I won't spend time on that other than to let you know that we are 13 hospitals across the two states, Northeast Tennessee and Southwest Virginia, over 90 physician practices, 8 urgent care centers, and then a host of other services and centers. So my point there is it's a very diverse organization. I'm sure many of the organizations on the phone can relate to the challenges of bringing together folks that work in such varied settings, even though we're all healthcare, bringing them together and aligning the work we do towards quality and safety. And that was one of the reasons that we came up with the idea, the concept of the Mountain States Quality Awards program. So on my next slide, we actually start jumping into the four components of the program. And before I go into the first one, which is project entry, I want to give you just a little bit of background so that you can have that perspective as we go through the four components. We just completed in February the 14th year of our Quality Awards program. We will be celebrating our 15th anniversary of our Quality Awards program. The program project entry that we're going to talk about here in a moment will actually kick off in August. So the program, while for many folks may feel like it's a 2 or 3 hour banquet in February of each year, the program itself is really a year-round program. We started in year one with the motivation to how can we align everyone around improving for quality and safety for our patients? How can we get them excited about improvement so that it's not just another task in their work? And how can we equip people to improve quality and safety in all the areas of healthcare and hopefully put some type of recognition and enjoyment in it? So I wanted you to have that background. That's where we started 14 and a half years ago. The first program had 7 project entries. We served cake as a celebration. We had 50 people in attendance, and 27 of those were actually administrators and quality department representatives. This past February at a recognition banquet, to put it in perspective, we recognized 170 projects from across the organization. We recognized a little over 2,000 individuals, and we had people in attendance that were topping 850 individuals. So we've learned a lot of lessons along the way, and that's really what's behind what I want to share with you today. If you're interested in starting such a program, please reach out to me at the end of the program. So I'm going to move pretty quickly through the 4 components, and then please make sure you jot down any questions, and we'll answer as many as we can at the end. The first component is project entry. The screen before you is a snapshot of our entry program, and it's actually a real snapshot of a project award that won a very high recognition this year, a Strong Hand to Hold, which is our Cancer Navigator. On this entry page, all of our entries are electronic. The first year we did storyboards on, but the actual project is entered electronically. This comes with a lot of benefits. One, there's a lot of consistency. As you can see in the project entry screenshot, there are step-by-step instructions. You can see where the arrows, number 1 is where the person entering the project will enter some basic information such as the aim or the objective under project details. They'll list project team participants. They'll share a team photo, and they will indicate for us which of our 6 pillars this project would fall under. Would it be categorized as quality, as finance, as people, as service, as growth, or as innovation? Then under step 2, where the arrow is pointing, that's where the details of the project are actually submitted. And this is really a fillable form, and it also allows the entrant to attach a variety of supporting documentation, such as a flow chart, an Excel spreadsheet with data, data graphs. They can attach photos. So they follow a standardized form to enter the project, but they have a lot of flexibility and agility in the supporting documentation that they provide. You can also see that under the judging criteria, it actually follows PDCA or Plan, Do, Check, Act. That is the basic improvement methodology used the world over, and it's definitely the one used at Mountain State. So whether they're using basic tools or very advanced tools, like a Pareto diagram, a root cause analysis, or some of the other more advanced systematic tools, it all falls under PDCA. One of the things I mentioned as the motivation to start the Mountain States Quality Awards program 14 years ago was to equip individuals to successfully improve quality and safety. We chose PDCA, and that's why we have designed the project entry form around PDCA. This is the way that we encourage people, and one of the ways that we train them and equip them to have a methodology for improvement. And then finally, under area number 3, you'll see the project submission checklist to make sure that all the submissions are complete. One of the biggest benefits of having an electronic project entry form not only is the uniformity of the entry, but we're able to capture all project information, and I'll share with you towards the end of the presentation the key benefit of that. And it also allows us to have judges external judges to our projects virtually anywhere in the world because all judging is done electronically. In year one, we had to have judges physically on campus to judge storyboards, but now we can invite judges to participate and use their expertise to help further our quality and safety from anywhere in the world. So as we go to the next slide, this is just another snapshot so that you can see what the electronic submission form looks like. If someone was to start entering a project, this is what they would see. And so my intention here is just to let you know that you don't have to be an expert to enter into the quality awards. It's not difficult at all. If you can fill out a paper form, then you're probably able to enter a project in the Mountain States Quality Awards program. So when you look at the next slide, that is a completed entry form, and I realize that it is small. It's really just indicated to let you know what the diagram actually looks like. But once an individual has completed their entry form, this is the information that is captured and saved. This is the level of information that is available to our judges electronically, and then the project owners at any time can go back in and read their project. This is also captured in a broad database that covers 12 years of projects so that we can have a sharing database. The project entry phase starts in August or September of each year, and we typically leave it open for about 8 to 10 weeks. We've contemplated leaving the entry period open year-round, and I think there would be some benefit to that, but there's a lot of benefit to announcing the entry and the fanfare that goes around that and the communication and the excitement, so that's why we've decided to continue to limit it. Once the entry phase is completed, we move into the judging phase. On this next slide, for judging, have a little trouble advancing. Yep. Just a couple key points around our judges for some background. The qualifications for judges is to have some level of quality expertise. Now that's not your typical or stereotypical have to be a quality director or the vice president of quality or the chief medical officer. We recognize that quality shows up in a lot of areas. So we have individuals serving as judges that have quality in their job title, but the vast majority of them are leaders in their area or in their sector, but they do have some experience with PDCA or Baldrige criteria or Lean or Six Sigma. They come from all industries and sectors. They are familiar, of course, with PDCA, and 100% of our judges are external to Mountain States Health Alliance. We do like to have a balance of both business expertise and clinical expertise. So clinical expertise is not a requirement, but we do want to have a fair share of our judges with clinical background because so many of our projects are around clinical care. The membership of our panel of judges is above 60. So we have over 60 unique judges that have served over the last 14 years. Typically, in any 1 year, our panel of judges ranges from 20 to 28, many with multiple years of service, some of them more than 10 years of service. Our judges have an orientation each year to make sure, once again, that everything is standardized and aligned. And we do provide a handbook, an updated handbook to our judges to use as a guide. We recognize our judges at the banquet, so we invite them to attend our banquet and we recognize them, and then also with a handwritten note after the Quality Awards event. The next slide is just a snapshot of the welcome letter that serves as the first page of the judge's handbook. And then you will see a screenshot of the electronic judging form. This, you can see in the yellow shaded area, that is the same information that was captured from the electronic project entry form. And you can see under supporting documents, they have a link that takes them directly to all the supporting documents supplied by the project leader. Beneath that, you see the first few areas where judges will score the different criteria for each project. For example, baseline data, measurable gap is worth 5 points, a clear target for improvement is worth 5, et cetera, et cetera. And then they have a ranking that they assign to the right, 1, 2, 3, or 4. What you don't see here is a further description so that they will actually have an example of what clear baseline data would look like. They also have a description and some additional resources and examples in their judges orientation and handbook. The goal here is to standardize as much as possible so that everything is equitable. Another way that we ensure standardization and fair and complete judging is that we have at least 3 judges to judge every project. In the next page, you'll see some comments that I wanted to share over the last few years from our judges that might give you some insight into their experience. I've thoroughly enjoyed this opportunity, and I'm highly impressed in general with the Quality Awards program and the quality of submissions. I will tell you we didn't start there, but over the last 14 years, we have become very comfortable with our Quality Awards program, with the submission, and the level of expertise and understanding and use of PDCA has increased exponentially. I also wanted to point out the comment, the last one, what a learning experience, even for someone who has been in quality for many years. And that one was very important to us when we received that from a judge. I want to now quickly go into the third component of the Quality Awards program, and that is recognition. Now, for many people in our organization, this is the part that people see and feel. But I want to reiterate that the project entry and the judging phase is a lot of hours of work for a lot of individuals. And the recognition event that occurs for us in February of each year is actually kind of the end of the timeline. So as we go forward here, the next several slides are actually quite a few pictures and very few words, but I want to give you some background as you see some of the pictures that we have available, because the pictures actually do a much better job capturing the excitement, the elegance, and the exclusivity of the event. On the left-hand side, you see a program, the tall picture. It's actually a picture of our dinner table. So as you can see, we've went a long way to make it a very elegant and a very exclusive event. So only people listed on a project are invited, and they're able to bring one guest free of charge. The black program that you see there that's listed says 14th Annual Quality Awards Banquet. I'll show you some snapshots in a moment. That serves as an agenda for the evening, but it also serves as a very, very valuable inventory of submissions and introduction to the projects. On the upper right-hand side of the page, you see a snapshot of the awards that we give. Our top level awards receive acrylic trophies, certificates, and a cash prize, and our very top awards receive a crystal trophy, certificate, and cash prizes. And the lower right-hand corner, you see one of our winning teams up on stage. I hope you can tell that they're very excited. They're very proud to hold their crystal trophy. And you can see that we have a pretty highly decorated stage in the background. So every single project is recognized either by having their pictures on a large Jumbotron screen. And for our levels 4 and 5, which are our higher levels and our special pillar awards, they're actually welcomed on stage with a lot of fanfare, and they're recognized by an executive at Mountain State Health Alliance and then receive their trophy on stage. The next slide shows you a few more pictures, a little bit less formal. The recognition event takes place at the Meadowview Conference Center, which is the largest conference center that we have in the Tri-Cities area to host the event. And we're actually a little fearful that we're going to outgrow that venue this year. So we're keeping our eyes open for additional options. These pictures here, the upper left-hand corner, is the celebration that's occurring throughout the evening at individual team tables. They have noisemakers, they have lights, they bring their own props. So it's celebration not in the sense of a formal clapping when people run up on stage, but it's music, it's noisemakers, it's even dancing at sometimes. The lower left-hand corner is a snapshot of the slides that we use. It's a very typical looking slide to highlight each of the 170 projects that were entered this year got recognition on multiple screens, such as this one that you see in the lower left-hand corner from the intensive care unit. On the upper right-hand side, you see one of our CEOs congratulating two of her teammates. And this was right before the event, so the party started for them even before the event. And in the lower right-hand corner, you see our top innovation winner, and that was actually for a safety-related project, holding his crystal trophy up on stage. The next section is about sharing. Because as you know, and just by the virtue that you're on this call with VHHA, I know that you also recognize the value of sharing in order to not only deploy further any improvements that we have in quality and safety, but also to ensure the sustainability of any of the results we're able to achieve. So I wanted to share with you quickly some of the things that we've put in place in order to further deploy and to ensure sustainability. This is a snapshot out of the program that we distribute. That's the black booklet in one of the photos earlier. Each of the 170 projects are listed with an introduction or a summary statement to let the individual or whoever's reading it know, here's the title of the project, here's the hospital or department that submitted it, here's a synopsis of the aim or the objective of the project, and then it lists the team members so that not only are the team members recognized in this manner, but if you want to get more information, for example, the third one listed here, Bridging the Gap Woodridge. It's bridging the gap between inpatient care and then outpatient care for behavioral health patients, one of our top winners. You can look at this and realize you can find that Mr. Hopper was the project leader, and you can actually see any one of those individuals listed there and reach out to them for further information. So this not only is a recognition tool, but it's also one of the ways that we share. On the next slide, you'll see some photos of our storyboard exhibit. We have usually anywhere from 60 to 90 storyboards. It's not a requirement to enter a storyboard, but we strongly encourage a storyboard creation as a means to share the project, both the night of the event and then going forward. We also have a competition for storyboards, and we have some criteria for judging as well. In the next slide, you'll see one of our final ways to share, and that is we have accumulated a number, hundreds, actually over 1,000 projects over the last 14 years. We have captured them all in an online projects library where you can search projects over the 14 years of the quality awards and find out what was their aim, what was their success, who can I speak to. It's a resource at the fingertips of anyone with a Mountain States email address. And it also helps to put you in touch with individuals that might be able to give you further information about deployment. Now, to wrap up, I just wanted to briefly share some of the benefits of Mountain States Quality Awards program. It has helped further the engagement in quality improving for quality and safety. It's allowed us to equip our team members, physicians, volunteers, and students with a standardized methodology for improvement with measurable results. And it's allowed us to share outside of the organization as well. In addition to that, we have some participant comments, and I wanted to share a few of those with you. Quality Awards is the highlight of each year for my team. Nothing makes us prouder than to read that comment. I was so proud to bring my family member to the banquet so they could see how important quality is to our work. And I just want to get back to work after the banquet so I can get started on our next project. And for us, that lets us know that this program is successful in recognizing our team members, physicians, volunteers, and students. And it is successful in getting them excited about improving quality and safety. So the objectives when we first started out were to be familiar with the Mountain States Health Alliance Quality Awards program, to understand the 4 components of the program, to be aware of some of the benefits, and to know where to go to get more information. On the next slide, I've listed my name, my email address, and my office phone number. Very happy, me and my team, we're very happy and proud to share any of the details of our Quality Awards program with anyone that's interested. I know that there have been a number of organizations that have implemented either similar Quality Awards programs or have taken our information and designed their own. And I know that all of us on the call were dedicated to quality, and one of the important things about quality is sharing. So I just want to emphasize how willing we are to share. I have a couple of my fellow team members that are listening to the call as well. And so if you reach out to me, you may hear from any one of us, but I wanted to make sure that I emphasized that we're very willing to share. The other opportunity I wanted to make you aware of is we are always looking for expert judges, someone that has a background in quality or a background in any area of healthcare or business. So if you think you might be interested in learning more about Mountain State's Quality Awards, and if you believe you might have some time to volunteer as a judge, that's the best way to get an insider's view of how the Quality Awards work. So I wanted to present that opportunity as well. And at this point, I'll conclude my portion and hand it back over to the folks at VHHA.
Thank you, Tamara. I think that was a great presentation. I think that you may indeed get some calls from some folks. Again, we'll also send out the recording of this webinar, and we will also post it on the VHHA website, and I'll send out that link. So at this time, are there any questions for Tamara and to answer? Do we see any in the chat box? Any questions? If you have any other questions, you can email it. You can either email it to the VHHA here, or you can really email directly to Tamara and her team, and the email address is there on the last slide, which you all should have received. With that, we thank you for your time. Tamara and your team at Mountain State Health Alliance, we thank you for your presentation. Thank you for sharing, and y'all have a good day.
Thank you.